Hello, everyone. Today it is my pleasure to introduce my legendary friend, Haris Mobeen. Haris, how are you, my friend? It is so good to see you.
I'm good and nice to see you too. Uh,
I
Tell me
remember
something.
about 7, 8 years ago, I visited your home. You invited us over. We spent a night. It was a beautiful day we spent together. I hope we have to do that again. But thank you for taking the time to meet
I
me.
think
And
you are welcome anytime. It's a very nice day outside, and this area is beautiful in summers, so you should visit.
we have to plan a hiking trip because there are some beautiful places near where you live. I think you're not too far from Catskills, correct?
Uh, we are a bit far from Catskills, but we have
Finger Lakes.
Finger Lakes and Adirondacks, which are not too far from here,
Yeah.
and Great Lakes are also in our
Um,
neighborhood.
I know that many people would enjoy this conversation because you're a man of many talents. You have a encyclopedic knowledge and a photogenic memory. So let me start with going back to our class. Those good old days when we were in RMC. And what do you remember from those days, Haris? Tell us.
So I have few good memories and not so good memories. But what I do remember is I think it was final year, and I went into a lecture. I rarely went there, and there was a lady. She was announcing that today is the last day of medicine lectures, and with this we have concluded the entire internal medicine. And I I had never seen her before. So I don't ever remember attending her any of her lectures. And I later on found out that she was the head of a department in Holy Family. Um, so that was one memory. The other memories are all my friends, including yourself, uh,
Okay.
Adnan, Farhan, and Asif, and lots of friends. We had some good times.
We had some fun times. And yours and my friendship actually grew a lot more stronger and deeper after we graduated. And we're going to get into that. But a question that we start with everybody: how did you got put into this mess? How did you become a physician? I'm just kidding, but what motivated you to become a physician?
Growing up, I had no clear plan to be a physician,
Mm.
but I think we had this discussion before also. My motivation was a family physician that took care of all my family, Dr. Khalil. He still practices. He's in his 90s, in Rawalpindi. So he took care of my whole family for years and years and years, and not only my family but my extended family.
Mm.
So that kind of motivated me to be a doctor. So I would say a good role model, I guess,
Yeah.
about motivation.
And being a student growing up in Rawalpindi, did you always thought of going to Rawalpindi, or was there another medical school that you wanted to be?
I think in those days, King Edward used to be the best one.
Yeah.
Um, so I think I did apply for that. My merit, I think, came in Allama Iqbal, but I opted to be in
In
Pindi
hmm.
uh, because it's home, and so that's where I chose to stay.
Yeah. Um, as a medical student, we were not as serious about illnesses and diseases, but you know, as we graduated, we started thinking about what to do, right? And then in house job started. So where did you do your house job?
So after MBBS, I went to Holy Family with Dr. Naseemullah, and I
Oh,
did 6 months with him, and I had a great time, and I had a lot of learning in those days. And so after that, I did another 6 months of surgical house job with Dr. Asif Zafar at Holy Family. And after that, I just started working here and there in some private practices.
Okay.
And so that's how far the house job is.
So, Haris, I don't know if you remember, completely recall, I give a lot of credit of my presence in United States. My journey to United States started after we met each other. I can't recall. Do you remember where did we meet and how did we started talking about USMLE? Because I know that I did not really had an idea coming to US ever. I was thinking about going to England, but I failed the IELTS exam, the English exam, and I don't know what I was doing. So tell me a little bit about what you recall.
So I think after the house job, I started working in some private practices,
Hmm.
and for some time I went to Foundation Medical College as an anatomy demonstrator also,
Okay.
and so then I decided to train in surgery. So I did a Part 1 FCPS. So I think we were both taking that exam in PC, in Pearl Continental Hotel in Rawalpindi. I think
Yeah,
that's where we met
that's where
after
we
a
met.
while. Yeah, and and I could see both of us were lost. So I come from a non-physician family, and
Yeah.
uh, I had no real guidance, and I did FCPS surgery. I think you did surgery or medicine. I don't remember what you did, but you did something.
Yeah.
Uh,
As as I recall, I think I was not sure what to do, and I did my house job in surgery and then medicine, and so eventually we both met, and then you told me something about Farhan Lamba, the Siddiqui, right? And you said and then you told me some books to read and all that stuff.
so I think by that time I realized that I better do something with my life,
Yeah,
uh, and either I should train in Pakistan and do FCPS, um, and but I wanted to go out of Rawalpindi, so I went to Aga Khan and I did an interview. Actually, did two of them, and I didn't get in, and then then I did the Public Service Commission exam
oh really?
and ended up getting a post in a polyclinic as a surgical registrar. But at the same time, I decided, maybe I should go somewhere. So, I mean, our friend Farhan, the Farhan Siddiq, um, I think he had been to US and he came back and he could not get a visa, and that's how we met him
Yeah,
again. I think he came to your place, and then we also met another friend of ours. I think Adnan Saftar, I think,
yeah, yeah,
and they were all planning to study and go to USA. And studying is something that I like, and I think studying is something that I can do. And I by that time I started, reading the USMLE books and started practicing questions. And I think then I ran into you at FCPS exam, and then I convinced you that I need a partner. And you were as lost as I was, so I think we both
we both. So
both
Haris,
decided.
I know that if it was not that day, and God, things happen for a reason. We really don't know and how but if that day you did not meet me and shared your thoughts and then followed other meetings and then eventually we decided to work together and I would have not been here. But we made a good team actually, and you are right that you loved studying and explaining. And one thing that I remember, a lot of concepts and logic of USMLE was new to me. And then you started kind of coaching me and telling me how to break down the exam, how to break down the questions, and how to approach it logically. And I know I could never get to the level of where you were. You were like the smoke used to come out of the books when you were done reading them.
I think you were smoking too much at that time. It was not the books.
Okay, so that was our path. Now, I know that you did extraordinarily well in USMLEs. And I think I remember you were you interviewed a University of Tennessee was in Pakistan, and you had just finished your two of your exams, and you had really high scores, almost probably maximum scores possible. And then you had an interview, remember? And then they offered you a spot, and then something visa problems happened.
So they offered me a spot, and then I applied for the visa.
Yeah,
Then 9/11 happened, and it happened around the same time. And so I think the visa took a long, long time. Um, it took so much. I think we applied for the visa again together at some point, I think.
yeah,
And I don't know, it took us maybe a year. I don't remember clearly, but it took us a long time for both of us.
yeah.
Um, and but eventually, you know, the it had to happen, so it happened, and both of
So,
us. I think.
so tell me a little bit about your uh, about how when you reached United States and you had to do your exam, um, what did you find any difficulties getting to the CSA and trying to get land a residency spot? What was that journey like?
So I don't think it was an easy journey, because when I came, the visa I got the next day, I took the flight and landed in New York City, and I think 1 or 2 days later, I still was jet lagged and took the exam. Um, and then I had to retake it at least one more time. So I did not. I think I did not qualify in the first go.
Okay.
And so in the second time around, what I did was I had a partner. Uh, I found somebody randomly on internet in Philadelphia. He was a guy from Allama Iqbal,
Hmm.
and we spent about maybe I think a few weeks together, and then I took it again, and then I passed, and then I went to Farhan, the Farhan City.
Fargo, North Dakota.
I went to Fargo, North Dakota, because I had no place to live,
Yeah.
and so I stayed with him. I washed his dishes and I cleaned his house, his apartment, as a payment to live there. Um, and meanwhile, I met my future wife, you know.
In that area. Okay, good.
Um, and then eventually I moved to New York. And then, long story short, eventually I matched in Hershey, Pennsylvania. Um,
Oh, that's a beautiful place. Um,
but in between, you know, I had some. I have experience of working at Dunkin' Donuts. I worked at a grocery store. I worked at a elder, or elder citizen, senior care company.
medical assistant yeah, type. Yeah.
I did a few things, but eventually I ended up matching in Hershey as a internal medicine resident.
You know, Haris, most of the physicians who are in United States, they've gone through a similar journey of at least doing jobs, not being a physician. And it teaches value of effort and money, right? What did you learn from this? Was there anything that you thought made you different or change you?
So I don't think it changed me as a person, because I'm still the same person. But what it does change, it teaches you the value of your education, what you have. Being
Hmm.
a doctor is a privilege,
No.
and it comes with a certain degree of monetary success. It also comes with a certain degree of
Correct.
social
Yeah.
standing. People respect you, and frankly, I'm thankful. That my dad kind of pushed me into it,
Okay.
and yeah.
So tell us a little bit about how was residency?
So residency. The first day when I when I went there, and when I came back around 5 or 6 p.m., I told my wife, let's pack up the bags, and I think we should go back. It was kind of hard, and then one day, then the next day came, the next day came, then next rotation came, and then I got used to it.
Yeah.
And then God blessed us with two children, so we kind of got busy in that. And eventually, I ended up becoming a chief resident. Out of 90 residents, they had three chief residents. I was one of them. And then that year I had a lot of fun. I did a lot of teaching, and I moonlighted quite a bit in the ER.
Hmm.
So I got my first taste of some money, and so that was cool. And
So,
sometimes
Haris,
it was kind of hard, but rewarding.
yeah, I mean, the life, the first 5 years in America, I can't really recall how did it go. It really goes fast because, as you explained, the residency kids and then chief residency, which is hard to achieve because you have to be really good in not only academically but a lot of other things. So, how did you decide to become then a nephrologist? What was the fellowship like passage?
So when you're a chief resident, you can do any fellowship afterwards, pretty much.
Yeah.
But I wanted to do something short. I did not want to spend 3 or 4 years.
Hmm.
And and Nephro was kind of cool. I had a good role model again. There was a guy, Dr. Miller, and I really liked what he did. And so between a role model, a short, 2 years of fellowship, and a knowledge base, which if you have good, internal medicine background, it's not that um, different. So so for that, I moved to Syracuse, New York, because my Susral is here. So that's why I moved here. And so it was a busy, uh, intense 2 years of high volume training.
I completely agree with you. I think we talked at that time when we were trying to decide on fellowships, and you had also thought about oncology at that time. And but nephrology is a complex field for me, at least. I can't really understand many of the aspects even now. So um, that when that completed, did you work as a nephrologist, or did you go on to do another fellowship? Because I know you have done critical care fellowship, but I don't really recall in between your life.
After I finished, nephrology, I started working with a private group, and I was with them for a year. On the sides, I always did some hospitalist moonlighting
Okay.
during the fellowship, during my nephrology private practice.
Yeah.
I always worked as a hospitalist, and frankly, I enjoyed more of the inpatient work
Yeah.
and the ICU work more than anything. So I decided, uh, maybe I should expand my horizons. And if you are certified in nephro or cardiology or pulmonary, um, you could easily do one more year. You are not required to do 2 or 3 years of training. So they
Interesting.
give you 1 year of training. I mean, the board allows you to train for one more year. So that's why I went for one more year of critical care.
And you went to a really good institution, Dartmouth, right? That's one of the Ivy League schools. And how was the experience there? What was the, uh, what did you feel about that institution and the life there?
The situation was great. When you walk in, it feels like you're walking in a five-star hotel.
Is that
That's the
right?
first impression you get.
Oh,
But medicine is medicine, same
yeah,
patients, same diseases. The faculty is really, 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 what should I say, dedicated to quality, and teaching. So, so I got a very broad exposure to critical care.
yeah.
Uh, it's a multidisciplinary critical care, so where you see trauma, neurosurgery, vascular surgery, um, surgical, medical, trauma, neurosurgical patients combined. It's not like they are separate services, but the critical care is critical care. So I got a really good mixed training.
So it sounds like a phenomenal place to do training. Now, soon after you graduated in critical care, um, to the current position, how was that journey?
So, we always knew that we're going to come back to this area because my wife's family lives here.
Yeah.
And so I came back here, I became a hospitalist and started doing ICU and ER on the side.
Okay.
and ended up becoming the director of the ICU of a hospital, Oswego Hospital. I did that for I think 3 years, 3.5 years, and then I came. I had a car accident, so that changed my, uh, you know, I didn't want to commute anymore, so I became local in Syracuse. So I started going to the VA,
Okay.
where I did everything, including hospitalist, ICU, and a nephrology clinic for next 2 to 3 years, I think.
Yeah.
And and then eventually my parent institution, upstate, I got a phone call from the chair of medicine. They said, "Well, we are looking for a nephrologist. Do you want to come back?" And I'm like, "Sure." I'm right next door actually. So he was nice. He kept up with all of us. I think all of his graduates. So he offered me a job, and I accepted it, and I came back to upstate about I think 3 years ago.
Oh wow! So now you are at the institution, the mother institution, the alma mater where you started, and now you're back there. And I guess you are involved in teaching now. Are you part of their teaching faculty?
Yeah, so this is a academic institution. It's a university hospital. So I'm the program director for the nephrology fellowship, uh,
Interesting.
and
Okay.
uh, and I also am the director of the acute dialysis services at the university hospital. So all the dialysis that we provide, I oversee that. Um, so luckily, because it's a nice and progressive institution, if you work hard, they give you a chance to progress also. So every, what should I say, 12 months or so, I've been getting some sort of, um,
Promotion.
promotion.
Yeah.
And so as far as teaching is concerned, as a program director, I arrange the schedule. I arrange all the conferences, all the teaching. Also, I've been teaching medical students for the last 3 years. Uh, Physical exam, history and physical examination. We call it practice of medicine course. So I conduct that among many faculty. I'm one of them. Um, and
So
so
how is it
that's
like
what
to
I
be a
do.
teacher again and teaching the residents and fellows?
Well, I think it makes my job interesting. I've done private practice also,
Yeah.
and coming back to this, you're not very far away from. Some of the faculty are very well known. They have their niches. So if you have some difficult patients or situations, you can always find someone who knows more than you.
Yeah.
Uh, and then teaching the your own field like nephrology to the students and residents and fellows, I think you always have to be a little bit up to date on what you're trying to teach them, and then you conduct formal lectures, and conferences, so that keeps you kind of up to date.
So, Haris, what is the setup that education is conducted in SUNY? Is it the regular lectures that halls that we used to go in our medical school? Is it now different in SUNY?
So I mean, I can speak about the residency and fellowships. I'm not very sure how the basic years are conducted,
Okay.
but pre-COVID, we had you know same lectures, online, resources also, noon conferences, and then maybe morning lectures or evening, and quality conferences and M&Ms, journal clubs. So we did all of them in person, but during COVID and I think post-COVID, it's going to be a lot of Zoom or WebEx or whatever,
Yeah.
So these days we are all exclusively doing Zoom meetings. All the lectures are the same, but we use Zoom or WebEx as our,
As
meeting.
more of okay. Now, I know that you always liked solving tough, complex medical problems. So that's why you have nephrology and critical care. You like teaching. So do you think this is like the place that you really foresee yourself continuing this job? Is this sort of closer to your dream job that you would like to say?
Yes, I think it's pretty much uh, what a nice academic nephrology job would look like.
Yeah,
And I think I'm done experimenting, so I'm happy where I am.
very nice.
And,
Good.
yeah.
Let me ask you, as a physician who has seen emergency room work, who has seen hospitalist work, now as a academic physician, what are the biggest roadblocks that you see to provide a better care in this country and maybe in the setting of COVID-19? Is there any roadblocks that you see that we are we need to change?
So I think the roadblocks are the usual. I mean, I think one of the things that bothers me personally is the amount of documentation that you have to do.
Yeah, yeah,
I mean, whether it's COVID or not COVID, the documentation is the same. And I think if it somehow can be reduced uh, and unlinked from the payment structure, because we use evaluation and management codes, which depend on your degree of
yeah,
documentation. So I think they should be uncoupled. The documentation should be enough to convey what happened clinically, but not, you know, a, a document of like 20 pages to just say that we just gave him a flu shot.
yeah.
So, so
That's
I would reduce that. I would just change that. Other than that, I don't have any particular
I
insight.
think I think it's a very intelligent thought, uncoupling the process of documentation would help our lives significantly better. And let me ask you about that accident and how that made difference in your health and your resilience. What
I mean,
happened?
it was just an unfortunate accident. We live up in the snow belt area. There's a lot of snow in Syracuse. So winters are very 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 snowy and
Yeah,
cold. So you need a four-wheel drive and snow tires and all that. The only thing that changed was I decided not to commute that much
hmm.
for extra income or work. I just try to stay within maybe 10 miles of my home for all of my work. Um, Physically, I mean, I did have some injuries initially, but I recovered in a few
You
weeks.
recovered. Okay, good. I'm glad. Thanks, God. How now? How is your lifestyle now? How do you balance the famous term that doctors use in US is work-life balance? What is it like for you right now?
So, as I said, this is my dream job, and I think the dream job means that I have what I want. And so I have a reasonable amount of compensation. I have a reasonable amount of time in which I can pursue other things that I want to, outside of work and also inside. There's a lot of flexibility. I usually look for flexibility.
Yeah.
Um, you know, Unlike private practice, I have other, duties too, uh, like teaching. So that takes some of my time.
Hmm.
Um, so, I think my work-life balance, my call schedule, my overnight, commitments, they are very well balanced. So I don't have any issue.
Any? I'm glad. I'm glad. So, is there any life advice, anything that you would like to share with younger people who are following our path? Maybe things that you wish you knew at that time, and you can give it to younger people.
So I think RNC was a great institution in terms of getting a medical degree.
Hmm.
I think the education was reasonably good, both the basics and the clinicals.
Yeah.
But I seriously think there was no career guidance.
Yeah.
There was none. Um, and being from a non-physician family, you know, um, I did not have any guidance from any of my clinical preceptors or my seniors.
Yeah.
I had to figure it out myself. I'm not complaining, but what I see here is, I think in US med schools, there is a lot of guidance available and you're exposed to lots of things with an intention that you would like something and you would pick something.
Yeah.
I don't remember anything of that sort. um, that I would recommend to RMC or any Pakistani medical university that they should institute some sort of career counseling. I don't know if they do or not at this time, but they should.
But they should. Okay, that's good.
But
Um, Haris, there is also a part of you that wants to help people, and I want to know what are the group of or community um, here in America or somewhere else that your heart goes out to, and you want to mention them in this talk.
so I think any community in the world who is suppressed politically or militarily or financially, who are displaced from their homes,
Hmm.
or who do not have peace in their countries, my heart goes out to all of them.
Yeah,
And I wish and pray that, people would focus more on peace so that people can thrive,
yeah,
rather than wars and all that. So any suppressed minority, any suppressed group, uh, regardless of their religious affiliation, I would say that they should be supported.
yeah. Very nice. Um, I want to ask you a little bit about your recent trips to Pakistan, and have you had the encounter to meet some of your old friends, or maybe meet a nephrologist in state of nephrology in Pakistan? That you have any idea about what's happening there?
So, I have gone to Pakistan very sporadically. I was there, I think, last year, but I stayed only for a week.
Hmm.
And I basically go and meet my parents, my
Yeah,
brothers, and their families. And unfortunately, I did not run into any of my old
friends.
friends.
Yeah,
Recently, I did go to London, and I ran into Mohsin. Mohsin Raza.
yeah.
When I went to Pakistan, I called up a few of my old friends, but didn't. There was no time to really
Time to really meet. Yeah.
meet anyone. So
Okay.
next time when I go, I'll probably plan
But
it.
we'll plan it. Okay. That's wonderful. Okay. So, one last question about your profession. And I know that I wanted to ask you this question about as a nephrologist. A lot of times people ask, and you would know that people ask me, and I really refer them to when is a good time for people to offer peritoneal dialysis?
I think it's a patient choice because the outcomes are almost the same with peritoneal dialysis versus hemodialysis. Actually, early on, within first 2 years, the morbidity slash mortality is better with peritoneal dialysis.
Hmm.
And if you are somebody who's ambulatory, who's independent, and keep your independence, then for these people, PD may be a better choice if they do not have any extensive abdominal, surgeries either, and if there is desire to be independent, and they are willing to put up some effort and work and learn,
Hmm.
so there's a process. I mean, we have staff who actually does all the education. Um, Once you identify somebody who's willing to take on a lot of responsibility for their own care, they go through a training process and then they choose.
Okay.
It's not just like a decision that is made, on a coin flip.
It's a
It's a little
thought
bit more
process.
involved.
Yeah. Discussion.
Yeah.
One last question in our professional section I want to ask you. I think of nef- kidney as an organ as a very resilient organ because we insult it, we injure it so many times, and sometimes we are fortunate. Mostly, we are fortunate it recovers. Do you think that overall people, medicine physicians, they need to be a little bit more aware of uh, what we do to the kidneys? Because you see the other end of it, like, a patient on Celebrex, like a rheumatologist like me would give them, and then you'll see a patient with a renal injury. What do you think of this organ and the practice, how it's being done right now?
So I think the kidney injury comes as an afterthought usually. You
Yeah,
if you are giving somebody Celebrex, I don't think you're really thinking about the kidney.
yeah,
If somebody's doing a CAT scan or a cardiac catheterization. If the kidney function is normal, they are probably not even thinking about it.
Yeah.
They usually do their due diligence, they check a creatinine level or whatever. But it is resilient, as you said. It does recover quite a bit, quite a number of times. But sometimes the recovery is not complete, and some people do end up with chronic, chronic
Mm.
kidney disease.
Yeah.
And so the usual, I mean, teaching is you should avoid nephrotoxins, do the high risk procedures only if they are needed. Pay attention to your medication interaction and all that, and those adjustments for the kidney function. And but usually for us, it becomes a routine. We just have to look at the data and identify who did what, and kind of figure out when did the kidney function start going down. So unfortunately, there's not much you can do. I mean, there's prevention, and then there's wait. You have to wait it out.
Yeah.
But the other kind, like glomerulonephritis or something else, or interstitial nephritis, you could treat it, and we do treat them. But the garden variety ATN or pre-renal or whatever is usually patient plus their doctors who did something, So, um, but a lot of time it does come back,
It
and I've
does come
seen
back. Yep.
people, people who lost kidney function for months, and then they start making urine, and then slowly, slowly, slowly they recover. I've seen quite a bit of that also.
Well, I hope all of us could gain some of that resilience in our day-to-day life. Um, has COVID changed anything for you as a nephrologist, dialysis, things like that?
So I think the what it has changed our rounding. It has changed our patient interaction.
Hmm.
There is some technology. We sometimes, defer the physical exam to one person. Sometimes we try to place the machines in such a way that they're outside the rooms and not in the rooms
Yep.
with the patients. And there was a lot of planning which went into to deal with surge, you know,
Yeah.
patients, and uh, infection control, and all those things. So they became very, very important. And So it did change a lot of things for us. But we are, second line. We are not the first line. The first line is usually the hospitalists in the ER or the ICU doctors.
Hmm. So are you guys checking patients when they come for dialysis or just screening for symptoms?
So they are screened with a questionnaire, and they are also screened their temperature is
Okay.
screened. Yeah.
Okay. All right, good. Thank you, Haris, for this thoughtful part of our professional interview. Thank you.